Today our lecture is on cardiac monitor. Everyone, welcome to POC Nurses Diaries. Cardiac monitor definition. Cardiac monitor is a device that shows the electrical activity and pressure waveform of cardiovascular system for measurement and treatment. Filled right pointing pointer parameters specific to respiratory system also be measured. Purposes of cardiac monitor. Continuously monitor cardiac rhythm, heart rate, BP, respiratory rate, SpO2 and also temperature. Used for continuous observation of critically ill patients in emergency department as well as critical care department. Greater than continuous cardiac monitoring help for prompt identification and initiation of treatment for cardiac arrhythmias and other conditions that affect on respiratory or cardiovascular system. It is useful for observation of post-operative patients, patient with severe electrolyte imbalances and other unstable patients. Functions of cardiac monitor. Continuous monitoring of vital signs in cardiac and pulmonary rhythm along with ECG. Alert when patients' vital signs are going above or below of preset values. Provide rhythm strip to document evidence of arrhythmias. Indications of cardiac monitor. Chest pain, palpitation, acute coronary syndrome, STEMI, NSTEMI, unstable angina. Following major surgeries, especially cardiac and neurosurgeries. Major trauma, post-cardiac or respiratory arrest. Acute medical conditions such as pulmonary embolus, drug overdose, electrolyte imbalances, etc. Unexplained syncope, shock, unconscious patients, critically ill patients. Basic features of cardiac monitor. Static bedside cardiac monitor system. ECG detected from patient electrode and transmitted to monitor via monitor lead cable. Display ECG rhythm continuously. ECG may duplicated to a central console monitoring system. Filled square SIM system incorporated computerized software to recognize life-threatening cardiac arrhythmias and alert. Telemetry monitoring. Filled square portable wireless cardiac monitoring system. Allow transmission of the ECG without requiring the patient to be attached to a static monitor. A patient's standard chest electrodes and leads are connected to small portable monitor transmitter. Cardiac rhythm is transmitted to receiver unit at central monitoring station where the rhythm is displayed continuously. Filled square suitable for ambulatory cardiac patients requiring ongoing ECG monitoring. Equipment required. Cardiac monitor, cardiac table, pressure transducer and BP cuff. ECG leads and electrodes. SpO2 probe. Alcohol, dry gauze. Temperature probe. Procedure. All electrical equipment are grounded to avoid electrical shock and artifact. Turn on monitor and connect the cables to the monitor, if not already attached, according to color code or instruction by the manufacturer. Open the electrode package and attach an electrode to each lead wire. Explain the procedure to patient and bystander and obtain consent. Wash hands and provide privacy to the patient and ensure that patient is in clean and dry. Expose the site for SpO2 probe, temperature probe and chest leads. Rub the selected site using washcloth or gauze pad briskly until it turns to redden, but care should be taken to avoid damage to the skin. Dead skin cells are removed in this manner, thereby promote better electrical conduction. Patient who are extremely hairy may need to be shaved prior to application of electrode. An alcohol pad is used to clean the site. Area should be completely dry before applying electrode. Alcohol shouldn't trapped beneath the electrode, it may leads to skin breakdown. Place electrodes in appropriate position. Each side of electrode is pushed against the skin and pull gently to ensure it is properly attached. Repeat over every electrode. Should press 2 fingers on electrode in a circular pattern to affix the gel and stabilize the electrode, then repeat on each electrode. To avoid the potential artifact, don't place electrode over bony prominence or hairy areas. Place SpO2 probe on finger. Place temperature probe according to hospital policy. Place BP cuff connected to the monitor on upper arm. Nurse's responsibility. Assess patient's condition and need for cardiac monitoring. If indicated, explain the procedure and obtain informed consent. Obtain all equipment needed and arrange at bedside. Ensure that all electrical equipment are grounded. Explain the procedure to the bystander and ask the patient to relax. Do the procedure. Filled right pointing small triangle. Confirm the monitor detecting each heartbeats by taking apical pulse and compare it with monitor readings. Filled right pointing small triangle. Evaluate the quality of tracing of electrodes and make adjustments as needed. Complications. Potential risk for electrolyte imbalances. Potential risk for skin breakdown at electrode placement site. Patient may allergic to adhesive used or the electrode may have been left on the skin too long. Electrodes should be removed and new electrodes or a PP light using hypoallergic electrode if necessary. Thanks for watching video. Subscribe YouTube channel and click on bell icon. Stay with POC Nurses Diaries for more.